Hi, my name is Miley Hewitt. Today we're going to be filming a sinus trigger. So first off, we're going to go and get our room ready. We have our tube detented at 40 inches and at a 90-degree angle to the wall bucky. First, we want to start off by wiping off our bucky, making sure it's nice and clean for when the patient arrives. We'll have our stool ready and our shield, and now we're ready to go grab the patient.
Hello, this is where you get sinus x-rays?
Yes. Is your name Omar?
Yeah.
Hi Omar, my name is Miley from X-Ray. Can you tell me your first and last name and date of birth?
My name is Omar Khan, and my birthday is January 30th, 1992.
Perfect. What brings you in today?
I have a sinus infection,
No.
yeah.
That's uncomfortable. Okay. Is there any chance you could be pregnant?
No.
No? Okay. So let me put this down, and we're going to start by having you sit on this stool, and you're going to face the wall bucky.
Okay.
Perfect. I'm going to have your chin and the tip of your nose up against right in that circle. Perfect. So we have the, we're going to start with the PA Codwell view, and we're going to have the OML at a 15-degree angle to the IR. We have the CR entering or exiting at the nasion. Make sure we're at the mid-sagittal plane. There. Perfect. I'm going to put my left marker up here on the board. And we're going to use a technique at 85 at 7. We'll go ahead and take that. X-ray. All right, you can relax for now. Next, we're going to do the waters view. So we're going to have the MML perpendicular to the IR. And the CR is going to exit at the acantium. So I'm just going to have you bring your forehead back a little bit. There we go, right about there. Sure. There. Actually, could have hit my left marker on the board. Perfect. And we're for this view, for the waters view, we're going to use 85 at 8 mass. All right. X-ray. All right. So next we're going to do our lateral projection. I'm going to have you slowly turn towards that wall there, and I'll tell you to stop. Right. There is good. I'm going to have you bring the left side of your face completely up against the board. And then move you up just a bit. Perfect. Right. Actually, so for the lateral view, we want our CR to enter half an inch to an inch posterior to the outer canthus. So I'm going to have him actually scoot you back. Bring this down. Just a little bit more back. There we go. Oh yeah. Right there. Left marker. Forward. Just bring in that elevation a little bit. Alright. Oh. Sorry, watch your head for a second. There we go. Just like that. All right, so we're gonna go ahead and take that picture. We're going to use a KV about 85 at 3 mass. X-ray. All right, so we have one more picture. Omar, you can go ahead and relax. I'm going to have you face this X-ray tube right here. I would probably scoot your chair closer to the tube. And what I'm going to need you to do is put your head all the way back so that the top of your head is touching this board. It's a little uncomfortable. So this is the SMV or the submental vertical projection. We want the IOML to be parallel to the IR. And we want the horizontal CR to be between the angles of the mandible. So I'm going to move you just this way, just a tiny bit. There we go. Bring your head up just a bit, or like towards me. right marker on the right side. We're going to use the technique at 85 at about 14 mass. X-ray. All right. We're all done. You can go ahead and relax. Nice. Yes. Now that we have completed our images, we can evaluate to make sure that they are of acceptable quality. Our first image is our lateral projection. This is good because it demonstrates no rotation or tilt of the cranium. This can be seen by the superimposition of the orbital roofs and mandibular rami, superimposed mastoid regions, and EAM, external auditory meatus. Sella turcica is viewed in profile. All four of the sinus groups can be clearly seen, but the sphenoidal sinus is best demonstrated in this projection. Next is our PA axial with Waters method. In this image, we want to see the maxillary sinuses. The OML in proper position demonstrates the petrous ridges lying immediately inferior to the floor of the maxillary sinuses. This image also shows no rotation or tilt by demonstrating equal distance between the lateral borders of the skull and the lateral borders of the orbits on both sides. Orbits and maxillary sinuses are symmetrical on each side, and the mid-sagittal plane of the head is aligned with the long axis of the collimated field. Next is our PA axial projection with the Codwell method. This image shows good positioning by having no rotation or tilt, which is demonstrated by having equal distance between the lateral borders of the skull and the lateral borders of the orbits. The petrous ridges are symmetrical on both sides, and the mid-sagittal plane of the head is aligned with the long axis of the collimated field. The frontal sinus should be lying above the frontal nasal structures, and the anterior ethmoidal air cells lying above the petrous ridges. This is our SMV, or submental vertical projection. In this image, we want to see the sphenoid and ethmoid sinuses, the mandibular condyles anterior to the petrous ridges. This shows good positioning of having the IOML parallel to the IR by the superimposition of anterior frontal bones of the mental protuberance. You can also see no rotation of the cranium by seeing the equal distance from the lateral borders of the skull to the mandibular condyles on both sides.